I'm Dr. Mike Milligan. I'm here with Dr. Doug Thompson of Bloomfield Hills, Michigan. The earliest that I know dentist treating oral disease with testing to see which bacteria are present, then eradicating them, and then retesting to make sure that they're gone. Doug, thanks so much for being with us.
Thanks, Mike. I appreciate it.
Tell us about this, what you're doing in the way of pre-testing, post-testing, and why, the importance of this for the total health of the body.
Well, one of the things that we have to do when we see a patient, we often report conditions or things that we see,
right,
but they don't really know the meaning of that.
Right.
They don't really know how that condition is maybe a disability. So we have to, in very simple terms, let them know that if they have active inflammation, we know there's recent science that suggests that active inflammation could cause other issues,
right,
and that typically it's bugs driving that inflammation. We
right,
want to know which ones.
Right. Bacteria in the mouth,
yep,
that can go through the body, or their toxins causing inflammation, and a whole
correct,
host of other diseases of the heart and brain and etc.
Correct. And patients are very used to having a medical provider perform a test,
right,
look at the test result, treat the issue, and then look at the post-test result.
Absolutely.
And so the using that bacterial information is very, very it's very convincing for the patient. It makes it understandable.
Mm-hmm.
They get it, and it leads to higher treatment acceptance, and it leads to a much greater understanding of the disease process.
Right.
Should you want to go there with your patients?
Mm-hmm.
So it's simple. Too much inflammation is not enough. It's caused by bacteria. We have a way of figuring out which bacteria are there. We can apply some strategy to get rid of the bacteria. Then we can make sure that we did what we said we were going to do. We can do a retest.
Right, wonderful. And what are the problems that these bacteria can create throughout the body if we don't eradicate them in the mouth?
Yeah, the biggest area that I think has the most significance is both in the aggravation of the arteries. So people can have basically inflammation, that same redness they have around the teeth when they do have a lot of bugs. That's what's happening inside the blood vessels.
Right.
And the arterial disease is being redefined as maybe a constellation of inflammatory issues. Mm-hmm. So that just means it's additive inflammation. And that cumulative inflammation is what maybe triggers a heart attack. We used to think it was a disease of cholesterol, but we don't really think it's a disease of cholesterol anymore. Right. So as that comes clear, as oral care providers, and as dentists, and as a patient, if I were a patient, I would want to make sure that my dentist knows how to get rid of any oral inflammation that I have, because excess oral inflammation is potentially dangerous.
Absolutely. The oral inflammation can go anywhere that your blood goes, which is every organ of the body, every muscle, including your brain, heart, etc.
Yeah, I think of it like an oil rig fire. You know, you see these oil rig fires in the Gulf, mm-hmm, and these oil spills. We think it's a local problem, like the oil's just leaking out at the platform. Right. But when you see the extensive global reach of the danger of that, that's exactly what's happening in the mouth. The mouth is a gateway to the rest of the system, and you can be healthy with you can still have relative health, and you can have some minor oral disease, but if you have a lot of dental disease, you cannot be healthy.
Absolutely, yeah, it's going to affect the rest of your body. So what can the patient expect? You're going to, when they come in, you're going to do a test to find out what bacteria they have.
And that's only if the patient's diseased. If the patient has active disease and it looks like they have excessive inflammation, mm-hmm, then we'll offer the test to them. And we typically won't offer the test to anybody that doesn't want to have the disease eradicated.
Right.
So I try not to. We try to be very courteous, that we don't just do tests for no reason. So when a patient is willing to and has a desire to have a really healthy mouth and they want to get rid of that inflammation, then we offer the test, and we use it then. And then we use the test to confirm, again, that the disease is stabilized.
And this is about how much later? 4 months or so?
It can be up to as soon as 8 weeks, but it's really whenever there's zero bleeding. So whenever you redo the basically the gum mapping or the periodontal probing and there's zero bleeding, then we know we should really take a new profile and find out what the bacteria look like.
Actually, you can have some of these bad bacteria without many clinical signs of the disease. You
There's-
can look fairly healthy and still have some really bad bacteria
And
in
that-
there that you need to eradicate.
There's no question about that. And as a matter of fact, that's where it gets a little bit difficult for us because we haven't been used to looking at disease that early in the process.
Right.
I mean, when I was in school, I was taught that if your tooth wasn't wiggling, it wasn't a problem.
Right.
Right? So,
remember.
I mean, it's a very different thing today. So,
Yeah.
we know that we can save patients thousands of dollars on the back end of dental care if we can stamp out oral infection early.
Right.
And it's really pretty easy when you do it early.
And we can save them much concern about their systemic health, possibly their life as well.
There's no question. I've had letters from patients who said, "Thank you for saving my life,"
Right.
and it's very rewarding to be involved with that.
What type of treatment do you do
The,
to
the
eradicate these bacteria?
Yeah, if you think about teeth, the teeth are part of your body that doesn't shed. Your hair falls out, your nails grow, your skin falls off, and anything living on that surface falls off when it exfoliates.
Right.
However, your teeth just sit there for years.
Right.
So if you allow a film, a layer, a thickness of bacteria to accumulate on the teeth, they're just going to stay there.
Right.
And what happens is that whole ecological environment takes on its own attitude, and it can get mean. And when it gets mean, your body reacts to it in a way that it wants to get it out. Much like when you get a splinter in your finger, you get a little redness around the splinter, pretty soon you get a little pus, you squeeze it, out comes a splinter. Well, that's what your body's trying to do with your tooth. And so if we see that and we have excess inflammation, then our patients know that we're gonna ask them and we're gonna offer them the opportunity to get rid of that.
Wonderful. Any last things you'd like to tell our patients here before we close?
Well, I think any practice that's thinking this way, working this way, offering these types of services is surely state of the art, totally on top of what's happening in the medical dental world, and that's the kind of dentist that I'd want to go to.
Dr. Thompson, thanks so much for being with us.
Thanks, Mike. I appreciate it.